Welcome to our discussion of sexually transmitted infections. For some of you, you might have learned this term as sexually transmitted diseases, or maybe you might have even learned the term venereal disease or VD. These are just sort of evolutions of the same term. What we're looking at are infections that can be acquired through sexual contact. Now, there are three main categories of sexually transmitted infections. There are the viral infections, which mean that they're caused by a virus. And in general, the thing that makes viral infections different from the others is that there's nothing medically that can be done to cure the infection. The body might clear it itself, but there's nothing medically to do it. Bacterial infections, what really makes them notable is that they generally can be cleared using antibiotics. And then the final category is the parasitic infections, and they can often be cleared with either, depending on the parasite, antibiotics or some kind of topical treatment to kill the invader. Okay, let's start with viral. The first virus that we're going to talk about is herpes simplex virus 1. Okay, now like a lot of sexually transmitted infections, and frankly, like a lot of infections in general, there are multiple types of that same infection. So in herpes simplex virus 1, we're looking at the virus that causes the common cold sore. Fever blisters, you might have heard them called. So herpes simplex has in common, no matter which type you get, one of the things it has in common is that you'll have an outbreak. It'll cause a sore that looks like a blister that burns, and then it cracks open and scabs over. And it tends to recur in the same spot each time. And it recurs because the virus, the way that herpes simplex works is that it goes into your nerve cells and hides. And then when you're under stress, or you've been, in the case of cold sores, if you've been out in the wind or really cold or really hot, anything that's sort of stressful to the actual body, like physically stressful. Being pregnant can cause it because your body's under stress while you're pregnant. It can cause the virus to come back out of the nerve endings and expose themselves on the surface again and cause the sore. They can appear not just on your lip. This also is an example of somebody with herpes simplex virus 1. And so they've got the infection in their mouth, and they get their cold sore when it comes out. It causes this big sore on the roof of their mouth. This is a child who touched herpes simplex virus 1 with their hands and then transferred it to their eyes. It can live in all the mucous membranes. So technically you can even get it on your nose. And so you kind of see around this person's nose, they've got these sores, and they don't look quite the same around the eyes and the nose as they do on the lip or in the roof of the mouth, because they get a little scabby a little faster because the lips are more moist and the roof of the mouth is more moist. And so you get sort of this longer lasting blister look. So these are all caused in all these locations that you're looking at by the same strain of herpes simplex virus 1. By age 25, 50% of Americans have antibodies to herpes simplex virus 1, which means they've been exposed to it. By age 50, 90% of Americans have it. So this is a very widespread infection. So if you have never had an outbreak of a cold sore, and you manage to spend your entire life without an outbreak of a cold sore, you are absolutely in the minority. The vast majority of Americans at some point will catch herpes simplex virus 1. Now, herpes simplex virus 2 is what we call genital herpes. So here in this little picture on the top, we see a penis with chancres on it. They're blisters that... they start off, that white color is because there's like still skin covering it, and underneath it is the sore. Once that blister ruptures, then you get the crusting over, and a scab will develop and things like that. So that happens after the initial infection has occurred. So when a person gets exposed to herpes simplex virus 2, about 2 weeks later, they'll have what they think is the flu. They'll be achy, they'll have a fever, they're tired, things like that. After they recover from that, another 7 to 10 days, they'll get their first blister. And a lot of times, we're talking 3 weeks, 4 weeks after exposure. A person doesn't put it together with how they contracted it. It doesn't seem like it's related to how they actually contracted it, because so much time has elapsed between exposure and then actual blisters arriving. The way that both types of herpes is transmitted is through what we call viral shedding. And what that means is that the virus that's on the surface of the skin gets transmitted to someone else through, rubbing of the skin together. So in the case of herpes simplex virus 1, you can get it from kissing. You can get it from a person drinking out of a bottle and then you drinking out of that same bottle and picking up their shed virus that way. But it's being shed from the skin to either directly to other skin or with very little delay between the shedding and then the picking up. It can be transmitted through objects. Herpes simplex virus 2 tends to be shed during sexual activity. So usually when this, for example, penis were to come in contact with any mucous membrane, so it could be a mouth, a vagina, an anus, even an eye, anything like that, it could be the virus could be shed and transmitted. Now, the two different viruses really like their normal location. So it's really uncommon for herpes simplex virus 2 to move from the penis to the mouth. And it's unlikely for one to move down onto the genitals, but it's possible. So the easiest transmission is from genital to genital or genital to rectum. Those are on herpes simplex virus 2. There are antiherpetics, and you can take this for herpes simplex virus 1 also. There are medications that you can take to limit the duration of an outbreak, to, sort of reduce the likelihood of an outbreak, especially if a person knows that they're under a lot of stress, and this is the kind of thing that typically gives them an outbreak. Antiherpetics can really help with that. Sometimes people will try topical treatments, but that doesn't usually do very much. What do they call it? Herpes, stuff like that. That's something that you put on the actual blister. That doesn't really do a lot. What you want to do is sort of retract those herpes viruses back into the nerves where they will hide again until they want to come back out. Now, just to give you sort of a full spectrum of these kinds of viruses that lurk in the nerves and re-emerge, herpes simplex virus 1 and 2, and then another type of herpes, which is the chickenpox virus, varicella. When a person has the chickenpox when they're younger, when they recover, they don't necessarily clear the virus out of their system. The virus can go back into their nerve endings and maybe reemerge when they're older in the form of what we call shingles. So these are all viruses that sort of work in a very similar way by hiding in the nerve centers and then coming back out when the person's under stress. So here we have a nice drawing of how the epithelial cells, which are our skin cells, are down at the bottom in the yellow. And we've got the nerve cells that are, and if you haven't had your intro to psych class and learned about neurons, what we have is a nerve cell or a neuron, which has a cell body up at the top of the picture with its dendrites sticking out the top of it. And then extending downward toward the epithelial cell is the axon. And the axon then has those branching fibers at the bottom that are called terminal fibers that make contact with multiple epithelial cells. So when there is the primary infection where the herpes actually makes contact with the epithelial cell, it gets carried by the sensory neuron up into its cell body where it then can lay dormant in what we call the latent period. And so during latency, there's no outbreak, and the person might think, oh, good, I cleared it, it's gone. And then some kind of, stressor occurs, and it causes reactivation of that herpes virus, which then exits the cell body, goes down that axon and out into a epithelial cell, where now it can be shed out to the environment. What we used to think is that when the virus was in its latent period, that no viral shedding could occur. And so we used to believe, I'm emphasizing used to for a reason here, is that when you weren't experiencing an outbreak, you weren't having a cold sore, you weren't having a herpes outbreak on your genitals or your anus or whatever, that you couldn't pass it on to anyone. And now we realize that during that latent period, you may not be experiencing an outbreak, and that's why it's called latent, but you are still contagious and you can still shed virus. And so it turns out that is probably the number one reason why so many of us catch it, because we don't know who might have it. It's not like you can just check and see if there's an active sore. It can be dwelling inside the person as far as they're aware, but it's sheddable to a new recipient. And so that's probably why it's so contagious. Now, herpes simplex 1, about 90% of people will have antibodies to it by the time they're 50. It's less for herpes simplex virus 2. So just FYI. Here's our rates. I got this from a study on from 2013. So we've broken it down by sex, males on top and females on bottom. And then we've broken it down by just two major racial groups. We've got blacks on the left and Hispanics on the right. And we've got different years of data collection. So the darkest bar is from 1988 to 94. The next darkest bar would be the 1992 to 2002 data. The light blue bar is 2003 to 2006, and then the white bar is 2007 to 2010. And this is just so we could kind of see how things are changing across different cohorts of people, and then they follow them across time. So what we're looking at in the left-hand side of each panel is across. If you average across all the ages, you see the by-year data. And then you see broken out 14 to 19, 20 to 29, 30 to 39, and 40 to 49 as our age groups. And so one of the things that you'll notice is that for all racial groups, people who are 40 to 49 are more likely to have it than people who are 14 to 19. No matter what year we're talking about, it's just, as we age, it's more likely that we may have accumulated it. Even in the worst case scenario, which happens to be the 40 to 49-year-old Black females who have the highest incidence of herpes simplex virus, we're looking at less than 80% infection rate. So it's lower than it is with herpes simplex virus 1. So this is, and by the way, my label isn't as clear as the title of the paper is. This is only referring, these graphs only are referring to herpes simplex virus 2. So the lowest incident rates seem to be among white males. And so when we look at the 40 to 49-year-olds, where it should have been accumulating over time, right, our lowest rates are being displayed by white males, followed by white females, who are a little bit higher. So the white males looks like less than 20%. White females, it's a little more than 20%. Among blacks, it's higher, right? Like black males are probably around 50% by the time they're in their 40s. So we have an example of biological disparities, right, where sex can play a role. But what we're seeing is that males and females are not as different in their herpes rates as blacks are versus whites. And so it could be that there might be some biological vulnerabilities among blacks as far as being able to catch it or not being able to fight it off. And it might also be behavioral. There's a lot of factors that's just not really clear. And one of the things that is a real trap with regard to any infectious agent, but especially with sexually transmitted infections, is a tendency to blame the victim. What did they do to catch this? What behaviors did they engage in that made them vulnerable? And so it's really important not to make those kinds of leaps. It could be that everybody in this panel is engaging in the exact same behaviors, but some people are more vulnerable to contracting the virus than others. So we have to be really, really careful about just sort of guessing or expecting certain things. Okay. Hepatitis B. All right. This, when I was a student taking human sexuality in the dark ages of the 1980s, hepatitis B hadn't really been identified yet as a sexually transmitted infection. It wasn't until I started teaching this class in the 90s that it got recognized as a sexually transmitted infection. So hepatitis B is contracted or transmitted through exchange of bodily fluids. So the number one most common route of transmission is injecting drug use. About 60% of cases are attributable to injecting drugs using a shared needle. About 15% of the time, the transmission is sexually transmitted. So it's worth noting and worth being aware of that this is a sexually transmitted infection. Now, what it can do is cause jaundice because of cirrhosis of the liver. You might be familiar with the term cirrhosis of the liver with regard to alcoholism. Alcohol has to be filtered through the liver, and so a person who drinks a lot really taxes their liver, and they can end up with these hard spots on their liver. Well, cirrhosis can happen for lots of reasons. It's not just because of alcohol. And so this is one of those diseases that can cause it. So it causes hard spots on the liver, and what that does is reduces the liver's ability to produce bilirubin and absorb it and process it. And so you can end up with jaundice. And jaundice is depicted in this photograph, which is not colorized. This is a person who has too much bilirubin in their blood because their liver is shutting down. And so they've got, instead of whites of their eyes, they've got yellows of their eyes. And that yellow is so dramatic that it's kind of hard to tell that actually the skin has a yellow hue also, starting to build up too much bilirubin in the bloodstream. So the best way to prevent hepatitis B infection is to get your hepatitis B shots. Most of you probably have had them because they were required to go through K through 12 school in the U.S. They started being a requirement for school-age kids starting in about 1995 or 6, something like that. And the rationale for why it's a requirement for school-age kids isn't that we think they're going to get it through sexually transmitted infections. We worry that little kids might have, scraped knees and come in contact with each other's blood, and they could, through that kind of sharing of blood, actually transmit this disease. So getting vaccinated, and also you want to get vaccinated before you've possibly been exposed. Then it's the most effective, because if you've already got hepatitis B, then getting vaccinated isn't going to help you. So you got to prevent it. The treatments that we have available are not the greatest. We have a really great new one, I have to say. We have got a beautiful, really effective. It works in like 95% of cases, but it costs something like $100,000 for the treatment. So your best bet is to prevent. Our previous treatments, interferon, it just sort of would keep it at bay. Sometimes people will get liver transplants, but of course you're kind of down on the list because you've got a chronic disease that's going to ultimately kill the liver. And so they try and give the healthiest livers to the people who have the healthiest chance. And so the best treatment is prevention, right? So getting your hepatitis B shot is your best bet. I should say hepatitis B shots, because I think it's a series of 3. So here we have the incidence of acute hepatitis B by sex. And so we see that males have a higher rate than females overall. They're the green bar, the females are the pink bar. And you see that for both sexes, the incidence rate has been going down. The acute hepatitis, where they're moving on to that jaundice and the cirrhosis of the liver, the incidence has been going down. Here we have it broken down by race and ethnicity. I think what your eyes might be being drawn to first and foremost is that white line with the spike in it. That's got to be some kind of weird data. That 1 year, 2002, that must have been an unusual pattern for that white line. So try not to look at that. It's probably an anomaly. What you want to look at is that overall, for all races, the rates have been going down. So you're looking at a nice downward trajectory across all different racial groups. Here we have acute hepatitis B reports by risk and risk exposure / behavior. And so you'll see that, so first off, I want to orient you to the legend. So those big yellow bars are actually missing data. So of the people who responded, they left that blank, that they were an IV drug user or that they had sexual contact. They left that blank. So what you only want to look at is the gray bars, which is they said, yes, they are in that category, or they said no, which is the red bars. So for the injection drug users, most people said that they were not injection drug users, but if you look at that gray bar and compare it to the other gray bars for the other categories, injection drug user is the number one most common way to contract hepatitis B. Then we go down, actually, if we skip down a little bit, you'll notice there's a row called multiple sex partners. That has the next biggest yes bar. So injection drug use is about twice as likely than multiple sex partners to be associated with hepatitis B. But with regard to sexual contact, having multiple sex partners is the riskiest thing that a person can do. And then we have sexual contact and men who have sex with men having basically equal number, bars. And those are roughly 1/3 the size of the multiple sex partners. So the more sex partners a person has, the more likely they are to be exposed to hepatitis B. I've got this in the wrong spot. This is a herpes joke. Not a fan of the new Harry Potter book the person posted, and the paper's called Herpes Genitalis and the Philosopher's Stance. This should have been up earlier, but anyway, that was a joke. All right, let's go ahead and stop with my failed joke that was, 10 slides too late, and we will come back in the next segment and we will talk about human papillomavirus, commonly known as genital warts.